the Cornhusker kickback, which is, I understand now, been done away with. One of the things that, as provisions of this legislation that was particularly offensive was the carve-out for 800,000 Florida seniors exempt from cuts in Medicare Advantage program. There's 330,000 seniors under Medicare Advantage in my home state of Arizona. They're deeply concerned about that. They're deeply concerned about the carve-outs for Vermont, Massachusetts, Hawaii, Michigan, Connecticut. $100 million for a hospital in Connecticut. Why should that happen? They don't understand it. And at the town hall meetings that I conduct all over my state, people are angry. We promised them change in Washington, and what we got was a process that, whether it be the Hospital Association or the AMA or others, and one of them that was particularly egregious, and I won't go through the whole list, was Pharma. Pharma got an $80 billion deal, and in return for which they ran $150 million worth of ads in favor of, quote, health reform. Their over $2 million a year lobbyist was here at the White House and was reported to say in the media, a deal is a deal. And part of that deal was that there would not be competition amongst pharmaceutical companies for Medicare patients. The other, well, among others, was that the administration would oppose drug reimportation from Canada, a proposal that you supported in the United States Senate.
John, can I
just finish, please?
Well,
and then at Christmas Day, I believe it was Christmas, the majority leader said, quote, a number of states are treated differently than other states. That's what legislation is all about. That's compromise. Compromise is not the word for that. So when my constituents and Americans now who overwhelmingly reject this proposal say go back to the beginning, they want us to go back to the beginning. They want us not to do this kind of legislating. They want us to sit down together and do what's best for all Americans, not just for some people that live in Florida or happen to live in other favored states. They want a uniform treatment of all Americans. So I hope that that would be an argument for us to go through this 2,400-page document, remove all the special deals for the special interests and favored few, and treat all Americans the same under provisions of the law so that they will know that geography does not dictate what kind of health care they would receive. I thank you, Mr. President.
Let me just make this point, John, because we're not campaigning anymore. The election's over.
I'm reminded of that every day.
So we can spend the remainder of the time with our respective talking points going back and forth. We were supposed to be talking about insurance. Obviously, I'm sure that Harry Reid and Chris Dodd and others who went through an exhaustive process through both the House and the Senate with the most hearings, the most debates on the floor, the longest markup in 22 years on each and every one of these bills would have a response for you. My concern is that if we do that, then we're essentially back on Fox News or MSNBC on the split screen just arguing back and forth. So my hope would be that we can just focus on the issues of how we actually get a bill done. And this would probably be a good time to turn it over to Secretary Sebelius.
Could I just say, Mr. President, the American people care about what we did and how we did it.
Well,
and I think we ought, and it's a subject that I think we should discuss, and I thank you.
They absolutely do care about it, John, and I think that the way you characterized it obviously would get some strong objections from the other side. we can have a debate about process, or we can have a debate about how we're actually going to help the American people at this point. And I think that's the latter debate's the one that they care about a little bit more. So, Kathleen, why don't you just address some of the issues related to insurance reform? There's some agreement here, but I know that on the Republican side there are a couple of concerns about the issue of rate review, the issue of setting up some benchmark standards that insurance companies have to abide by. Some people may think that those have been a little bit too aggressive. You've been both a governor as well as an insurance commissioner. Maybe you can talk a little bit about what you've seen at all those different levels and how you think we can best move forward to protect American families.
Well, thank you, Mr. President, and I know there are lots of people who want to comment on these topics, but I don't think there's any question, and I think there's a lot of agreement that the current insurance market really fails way too many people. It is a system that is not a market for about 40 million Americans who are either in an individual policy or in a small group policy, have no choice. There is no competition. According to the American Medical Association, in their study yesterday, 99% of the market in metropolitan areas, 75% of the markets across the country are very concentrated, which means they're monopolies. They're not markets. So we got a trap. And I think the rules allow people to be locked out from the front end if you've got pre-existing conditions, allow people to be thrown out with a stop on benefits during the course of a treatment, or when your policy expires and you're supposed to renew, you're dumped out of the market, or to be priced out, which is going on across this country. There's been a highlight of a couple of rates, but double-digit rates across the country, on top of double-digit rates, on top of double-digit rates, and people have no choices. So the common areas, I think, of agreement, high-risk pools. There are lots of states across the country running high-risk pools. As an insurance commissioner, we ran the high-risk pool in Kansas. It is a strategy that's been in place for almost 30 years in many states. 200,000 people total in the entire United States are in high-risk pools because they're so expensive that they really don't offer it. Because when you put all the sick people together and you say, okay, you get to buy a policy, and you get no help with that policy, it is a death spiral. You will always have the highest cost, and on top of that, the highest cost, and you've got the sickest people who are already paying the highest cost for treatment. They don't work very well. They are a stopgap measure that the House and Senate have proposed to get people from here to a new market. I think what the exchanges have a lot in similarity with the health plans that have been talked about by the House and Senate. There's a big difference, and it's not a Washington difference, it's a state difference. The state insurance commissioners across this country have unanimously opposed health plans for decades, and they feel that it takes people, it isn't the pooling that's objectionable, it's the fact that there is no consumer protection, that there is no ability to apply common sense rules. And we had the drive-by deliveries in Kansas where people were being kicked out of the hospital 18 hours after having a baby to save money, only to be readmitted with jaundice and to be readmitted with dehydration. It's not a particularly good idea. So getting rid of pre-existing conditions, getting rid of caps on yearly benefits and long-time benefits, allowing kids to stay on plans are ideas that have been accepted by both, setting up a new marketplace, giving small business owners and individuals choice and competition in the private sector, but making the private sector operate on a different set of rules, including having some loss benefit analysis. How many of those dollars, you heard Senator Coburn eloquently talk about the 30 cents of every dollar that goes to pay for expenses other than medical costs. A loss benefit analysis, a medical ratio, would do just that. How many of your dollars are you actually spending on provider care, on prescriptions, on treatments, and how